Hello everyone, in this video, I want to talk about antibiotics. Without wasting any of your time, let's get it started. So, what exactly is antibiotics? I want you to imagine antibiotics like tiny soldiers that fight against bacteria in your body. Think of this bacteria as a bad guy that is making you sick, and antibiotics are the superheroes that come to save the day. So, in a nutshell, antibiotics are a class of drugs that kill or inhibit the growth of bacteria, helping to treat bacterial infections. A quick note, antibiotics does not kill viruses and does not kill fungi. There are many types of antibiotics. The first two on the list that we need to talk about are the broad-spectrum antibiotics and the narrow-spectrum antibiotics. Broad-spectrum simply means you can use this for a wide range of bacteria. For example, ciprofloxacin is used when the specific bacteria causing an infection are unknown. On the other hand, the narrow spectrum simply means this type of antibiotics target a specific types of bacteria. For example, penicillin G, used when the exact bacteria is known. The other types of antibiotics that are commonly used includes penicillins, cephalosporins, macrolides, fluoroquinolones, and tetracyclines. Penicillins works like a lock and key to block the bacteria's ability to build their protective walls. For example, amoxicillin is a drug under this category. The next one is cephalosporins. It is the same concept with penicillins, but it's a bit stronger, and it's often used when penicillins are not worked for the patient. An example of a drug in this category is ceftriaxone. The next one on the list is macrolides. This one is a little bit different. They work by stopping bacteria from making the proteins they need to live. Erythromycin is an example of drug in this category. Another one is fluoroquinolones. This one is kind of special because it directly works by interfering with the bacteria's DNA, stopping them from reproducing. Ciprofloxacin is a drug that falls in this category. Then the last on my list is tetracyclines. They also stop protein production, but in a different way than the macrolides. One of the famous drugs in this category is doxycycline. So, when should you use antibiotics? It's important to know that antibiotics only fight bacteria, and not viruses or fungi. So, they won't work against colds or flu. In a nutshell, antibiotics can treat bacterial infections like strep throat, urinary tract infections, and certain types of pneumonia. Common side effects include stomach upset, rash, dizziness, nausea, diarrhea, yeast infections, allergic reactions. It's very crucial to teach your patients to take antibiotics exactly as prescribed by the physician. Bacteria can learn how to fight back against antibiotics, and when they do so, it makes the antibiotics less effective. And this is what we call antibiotic resistance. So, in order to prevent this, it's important to take antibiotics only when necessary and complete the full course of treatment. Thank you for watching. Don't forget to subscribe, like, and share to help other people.